Hello, my name is Damone Chaplin, and I'm the Health Commissioner with the Minneapolis Health Department. I'm glad you're here to join us today. We are going to be discussing May is Mental Health Awareness Month, and we will be discussing the impacts of stress on the individuals and communities, particularly our BIPOC communities. And we will be talking about this idea or theory that we refer to as weathering, which is the cumulative impact of racism on a person over a period of time. Today we have with us to join us in this conversation Dr. Andre Perry, the mental health director from the Community University Healthcare Center, and Dr. Donna Minter, a licensed psychologist representing Minnesota Peacebuilding Leadership Institute.
Thank you.
Dr. Andre Perry, we'll start off with how would you explain the weathering theory to our community?
Okay. So weathering is a concept that's been proposed and researched by Dr. Arlene Geronimus. She's a public health researcher at the University of Michigan. And what she has found is that the communities from BIPOC communities and underrepresented communities, the everyday stress that they experience impacts their health and wellness. And that accounts for their chronic health conditions and lowered mortality rate or increased mortality rate, more so than genetics or lifestyle choices like diet and exercise.
And Dr. Minter, tell us about the population you serve and how weathering has impacted them.
Well, for over 13 years now at Minnesota Peacebuilding, we've been doing professional development and community education trainings, public health trainings around both individual and collective trauma. So when I learned about this weathering theory, I was like, we didn't call it weathering theory, but that's essentially what it is, this idea that particularly communities of color that have experienced structural traumas and historical traumas and cultural traumas, as well as other kinds of trauma and stress, that when that trauma remains unhealed, unless there are deliberate things that are done, both as individuals and communities, the trauma doesn't go away. It is in our bodies and our brains. So it's this idea of us being aware of it and being able to name it. So the communities that we have worked with are about a third of the folks that come to our community education trainings are from BIPOC communities, and the others are from white communities. And to learn this information and then have discussions together about it. Yeah.
That's important. And, diagnosis determines treatment, right? So when you say naming it, it's important to put a name to it. And so we're quickly approaching the anniversary of Mr. Floyd's murder. And so I'd love to get both of your feedback or, how you feel this has probably impacted the community here in Minneapolis and things that they could potentially do to help begin this process of healing.
I think, communities continue to see shootings and other traumas that happen in the community, which then people continue to get triggered, activates the fight or flight response. So just being on all the time, our cortisol's getting released. And so that weathers down the body. It really wears down the body in terms of the heart, in terms of the arteries, and even really at a cellular level. So there's impact from that. I've had clients that talk about wanting to maybe move out of the city because they don't feel safe, but then fearing going to the suburbs and am I going to be discriminated against there? So like there's that carries. Family members, parents that worry about their kids going to school, just the neighborhoods, and even like kids playing in the neighborhoods, whether there's because of drug use, things like that, like needles, so like that's a constant worry that parents have that people from BIPOC communities experience that maybe the general population doesn't experience that.
Yeah. Dr. Minter?
Could you ask the question again? I want to make sure I was listening so intently.
We're quickly approaching the anniversary of Mr. Floyd's death. Yeah. And so love to get your feedback on what communities can do or how, this may have had a community level impact on the folks who live in that area and in the city.
Absolutely.
And the country, I would
In
say.
the
that.
country, really. So what I would say is before Mr. Floyd was murdered and before COVID took over our lives, there were all these, the traumas that were unhealed, structural traumas, cultural traumas, historical traumas, they were there. And then when COVID took over our lives, it was like it just exacerbated that. And then when Mr. Floyd was murdered, it was just like a big rock hit the surface of the water and had this incredible ripple effect. So interestingly, right before COVID happened, when we started sheltering in place, we were actually scheduled to do a single day trauma awareness and resilience training in the Can-Do neighborhood, just less than a block from where Mr. Floyd was murdered. And we were working with the folks there to do this training, and then that ended because of COVID. But since that time, we have been asked by the leaders of that community to come back and do some trainings and some events with them so that people have a space, they have the language to talk about the trauma and stress that's happened, and then also to talk about ways that they can work together as a community to heal.
Yeah, it's interesting. As a person of color, and you think about the impacts of racism on a person's professional and personal life. I often refer to as gravity, this idea of weathering as gravity. And if you think about yourself or your personal or professional trajectory as a rocket ship, you need fuel to kind of get to where you need to be in outer space. The one thing that you don't see that's constantly has to be accounted for is gravity. It's constantly pulling on that spaceship, even though we have a certain amount of energy trying to lift us out into the into outer space. And so this idea of weathering or racism, it constantly pulls on you no matter what level that you achieve. And so it's important for folks to understand that it may have a cumulative effect on your overall health outcomes. We see that with stress, with depression, we see it with hypertension, high blood pressure, and even some weight gain. And so this idea of this cumulative impact of racism on the body and on the community, is something that we really want to elevate here at the health department. We, under the leadership of Commissioner Musicant, have began this conversation within the health department around trauma-informed care. And we have even provided some support to the community for programs to be able to kind of elevate this this conversation and work around trauma-informed care. In addition to that, we also have begun to kind of think about and kind of implement some trauma-informed practices here within the health department. So we've gone so far as even to hire someone to come in to help develop this trauma-informed plan for the health department. So we want to make sure that we're able to kind of work in-house first and really be more impactful on engaging with the community. This is really vital. It's important to reframe or to frame the conversation and to try to frame the work that needs to be done and what people may be experiencing. You mentioned something about the Can-Do program. Could you speak a little bit more about that, Dr. Minter?
Sir, so Can-Do is the acronym for Central Area Neighborhood Development Organization. So it's a Minneapolis neighborhood organization, which is where Mr. Floyd was murdered. So over time, a number of their community organizers came to our single-day training called Starlight that teaches trauma-informed, resilience-oriented, and restorative justice concepts and strategies. And he had actually just experienced a horrific trauma himself. And he came, after he got out of the hospital, he came to our training. And I think actually that training was funded by the City of Minneapolis Health Department. And it was in North Minneapolis. And he came and he just was like, I didn't know any of this language before. now I know this language. Now I know how I can heal myself and others and to work with community to heal. So then he instigated his neighborhood association to bring that same training to the Can Do neighborhood organization. Yeah.
Oh, that's wonderful.
Yeah.
And Dr. Perry, do you have any recommendations for our BIPOC communities who may be experiencing weathering individually and at the community level? Do you have any recommendations for them on how they can manage their own stress?
Sure. I think one of the important ways to manage stress is actually doing culture-specific activities. Mm-hmm. We know that culture and cultural identity is a protective factor against racism, against substance use, against suicide. So, yes, there's things about like, eating healthy and, exercising, those kind of pieces are important, but it's also important to connect with your culture, be with people that support you, understand your experience, because that is a way to get support, get affirmation, and also, again, having that identity is a protective factor against, outward stuff that's going on, racism, discrimination, things like that.
Mm-hmm. And Dr. Minter, do you mind telling us a little bit about your organization and the work that you guys do?
Sure. Well, back 13 years ago, we held our first 5-day strategies for trauma awareness and resilience training here in Minneapolis. And at the time, it was going to be one training. And then at that training, we had 26 people come, and it was a very diverse group for the 5 days. We had 5 different ethnic and racial groups, communities represented in 5 different religious traditions. And at the end of that training, people were saying, Donna, you got to do this again, because I have colleagues that would want to come to this training and family members. So out of that, one of the trainees, Chriselle Shell, who's now the executive director, came up to me and said, if you decide to do this again and you need help, let me know. So that's what started then the Minnesota Peace Building Leadership Institute. So we teach people trauma-informed, resilience-oriented, and restorative justice-focused trainings for the community, but also for professional development. Psychologists, mental health providers, nurses can get continuing education for our trainings. So we've been doing that for 13 years. When COVID hit, we started doing them online. We're now going back to in-person. And we've trained over 16,000 people now, both here in Minnesota, but then they've come from other places to do the training. So it started as a nonprofit so that we could also always be committed to economic justice. If people want to come to these trainings and they don't have the financial resources, we raise money as a nonprofit to make that accessible. Yeah.
And Dr. Perry, your organization?
Yeah, so Coop Community University Healthcare Center, we are a federally qualified health center, and we provide medical, dental, and mental health services. And we serve a wide variety of community. 37% of our patients are African or Black, 27% are Hispanic, 9% Asian, 4% are Native Americans. 40% of our visits are interpreted visits. And not only do we provide mental health services and medical services, but we also do a lot of advocacy. We have events to help patients get registered to vote, so that they can work on the systems level issues, that they can get representation that they need. We have the Salama group, and that is basically a participatory research group, so that research is done with folks versus research is done to them. So the community members are involved from the beginning in terms of like what's important to them, and their voices are heard. We also do a lot of work with refugees and immigrants, especially newly arrived evacuees, where we do medical examinations for them so they can qualify to be a refugee. So we've done that with Afghani population that have kind of come through last year, and then Ecuadorians currently.
Great. So I want to thank you all for joining us today, Dr. Minter and Dr. Perry, for joining this conversation with the Minneapolis Health Department and myself during Mental Health Awareness Month. This has been an informative conversation. I look forward to having you back to continue these conversations. Thank you again and have a great day.